you arrived? Today or yesterday?
Friday.
Friday, oh, okay.
Oh no,
What's
Friday. Wednesday, sorry.
Wednesday. Today's Friday. Okay, so you kind of get used to the area, huh? I like the hospital, that's a nice hospital. Overall, when I look at your nose, it's not a very difficult nose at all. It requires a little bit of a shortening, a little bit tilting up. You have some deviation to the right side, so we will correct the deviation, lift this up, correct the bone a little bit, and narrow the nostrils somewhat. While we are doing this, during the surgery, first we go in, we look at the septum, and if there is any kind of a nasal airway blockage, which I would assume there should be, because you have a deviation.
This side a little bit.
Yep, it looks like that, because now your septum is looking like this, which means that your left side should be blocked to a certain degree. We correct that. There will be no nasal packings. There will be a small nasal cast on top of your nose, and we'll be taking off next week before you go away. When is your flight going
Wednesday.
home? Wednesday. Okay, perfect. What time?
1 o'clock.
Perfect. So in the morning we can take off the cast, and then we can send you back home. We are not expecting any problem. It's going to be very smooth and easy surgery, and because of the techniques that we're using and the devices, you will feel pretty much level 0 pain. So it's going to be, almost painless. There will be swelling, there will be bruising, which is going to go away. You have a light skin color, so I would assume that you will bruise a lot, but we will see. Whether you bruise a lot or not, it doesn't matter. That's going to go away, in a few days' time, and that's pretty much it. Regarding the outcome, we want to get a natural outcome. So we don't want anybody to ask you, you had a rhinoplasty done, you have a nose job done. We don't want to hear that, unless you guide me to do a more aggressive nose surgery, making this slightly at the edge of natural and unnatural. So that's up to you. It depends on your job, it depends on your attitude towards the life, it depends on your social life as well. I have a variety of patients. I have attorney coming in, wants to have the nose job. On the other hand, I have dancers coming in for nose job as well. So both ladies probably are not going to like or want the same thing. So I do appreciate their desires as well. Same thing applies to you. So you can guide me towards to more natural or a little bit unnatural result as well. We can provide you both, either, whichever you prefer.
I don't know actually, natural is good, but I want really that smaller because,
That's big for your face, that's for sure. It's gonna get smaller, no doubt.
I had already teeth correction 2 years ago.
Oh, really?
Yes, and why I had just teeth correction? I was going to rhinoplasty, and my blood was too low, hemoglobin. That's why they said that they cannot do, and he offered me just a correction, teeth correction under.
Where did that happen?
In Lithuania. And after first hour, I think after operation, that was kind of okay. I saw that and I didn't see any result. And I read that I don't see much result, even that it looks bigger from profile. And and I think that tip is little bit kind of strong here. That was soft before.
We're not gonna allow that.
So that's it. That's why I would like that this, of course, little bit kind of down, because before that was, I don't know, I don't see different, but I think before that was little bit longer, just little bit.
Sure. Regarding the blood level, either you will go for the surgery or you will not go for the surgery at all. Because if something gonna go wrong because of the low blood level, whether that's a minor tip-plasty or full rhinoplasty, it's not gonna make any change. However, I'm sure that my colleague who did the operation on you, he had on his best way, try to give you the best outcome as well.
Yeah.
But from a medical perspective, either you go for a surgery or you don't go for a surgery. Because whenever you try to do less, usually the disappointment always ends up with the patient. Because then you had the surgery, you had the risk, you spent the money, you had the recovery time exactly, and at the end, what's the result?
I was waiting half a year for it.
Okay. Anyways, that's a kind of a misadventure that you had. No problem with that. We'll fix it. Okay.
And it is not a problem yesterday that I had some pain after flight in my ears.
Not really, unless you have running fever, temperature, anything like that. No.
No, it was blocked nose.
Okay.
This side.
That's because of the symptom deviation.
Yeah,
so
probably. I was reading but I was worried. Really.
Currently now, where are you living?
In here in.
No. I mean.
Dublin.
Dublin. Okay.
Yeah.
Okay. You're from Ireland.
Yeah.
Okay. Cool. Good. Okay. Is this first time in Turkey?
Yes.
Okay. Enjoy your rounds. Have fun today. Walk around, enjoy your dinner.
I was
after
walking yesterday and I was kind of. I don't want to go anymore. Goodbye.
Hi Tamara.
Hello.
Welcome to our office today. Thanks for accepting our invitation. We wanted to talk about your experience, but firstly, can you introduce yourself to us?
Yes, my name is Tamara. I'm from Latvia, but at the moment I live in Ireland. So
You are working, right?
I'm working in Ireland,
Oh, okay.
and I'm living there. I moved for all my life there, so
Oh.
forever.
Okay, and how did you find about us, FlyHealth?
I was looking for surgery. I was looking exactly into Turkey, and somehow I find the video and the YouTube, and I start looking. What is that? What's that? What's that FlyHealth? Who is that? And then I saw more and more videos, and was good reviews. I start looking about that, and then
It's
I connect
give you a good feeling.
Yes, of course, because I knew that I will go alone, and I didn't want to go alone. Before I was booking actually to another doctor in another city, but I wasn't sure about that, and I was looking for something more safe. I would
Safe,
say.
that's feel more safe with FlyHealth.
Yeah.
And I think it's your second time surgery.
Yeah, I had before tip correction, but I didn't see any result after that, so I was looking for something.
And that was in Lithuania?
Lithuania, that was 2 years ago in Lithuania,
Okay, but I still assume you had some concerns in your mind before you come to Turkey. Maybe you were not very sure about it.
Of course I wasn't, because I'm a young girl and I want to go alone, and of course I was scared, but
did we help you?
Yes, of course you helped me a lot. My representative, he showed me the town, he showed me around, and I find.
Okay, so you were scared because of coming alone.
Yeah, because it's Turkey, everybody saying about Turkey it's dangerous country, but it's not at all. It's good European country.
Yes, and also I think you stay in nice places, that's safe.
In the European side of city.
Yes.
Like I don't feel big different that I'm in my country or here, just
it was good.
Safe and good,
Okay, nice to hear. And so how was your time in Istanbul? Did you enjoy? Could you do anything apart from the surgery?
I did shopping, of course. This is the best place for shopping, I think. I didn't see much. Maybe if I would stay longer, I would see much. Actually, I don't want to go home. I'm not ready yet, but because I want to see something else.
But tomorrow is the last.
Tomorrow I'm flying,
Yeah.
So,
Maybe next time.
yeah, maybe next time if I will come for sure. I will come for longer time and I will see the city.
Okay, so you enjoyed the time.
Yeah, as much I could. I enjoyed. Yeah.
Okay, perfect. If you think about the clinic, hospital, doctor,
Hospital was perfect.
how
It
was
was
it?
very clean, very big, and doctors, nurses, everything was so quick that I couldn't realize when I fell asleep. Yeah, and I was happy when I wake up that everything was done so quick
Finished.
and finished and it was really good because before in my experience that was so long that one doctor then second doctor and here was like everybody
Everything
was so
efficient
yes
in that way.
very good. I'm happy about that.
Okay, nice to hear. Would you recommend FlyHealth to your family, friends, or?
Definitely, if somebody wanna go in Turkey for surgery, you can go. You can connect Ozge, and
Thank you.
never be scared. It's really safe. I came alone, and you see, I'm
Everything.
fine. Yes, nothing happened to me.
Perfect. Thank you so much, Tamara.
Yeah.
Thanks for sharing
you.
your thoughts. And we wish you nice flight back home
Yes.
and enjoy your new look.
Yeah.
And we keep in touch.
Thank
you.
you.